table well for my presentation, and I think they are very complementary. And so I also start from a perspective of needs, starting from needs. So that's because if we want a post-capitalist future to be both sustainable and desirable, we have to put the fulfillment of needs at the center of it. And in contrast to capitalism, in which it forces people to work if they want to address or fulfill even their basic human needs, a major argument for post-capitalism is saying that we could collectively reorient social resources towards the most essential purposes, while limiting the destructive impact on the environment. And so to be able to do that, we need institutions to be able to decide together what we consider to be basic needs, but we need more than that. We also need institutions to be able to define where, when, and by whom these needs will be fulfilled. I realize I think the projector is a bit off, but I think it's not that bad. Yeah, thank you, that's great. And so to fulfill needs, we need more than just products. It's more than just producing a set of goods that people need. We need so-called services or specific forms of work, like care work, and we also need specific conditions, like privacy, certain forms of relationality, and on and on. And these imply different social settings and organizations. So because of that, we can't completely rationalize needs provision like we can rationalize factory work. Fortunately, feminists have been thinking about social reproduction and care work for some time, and so I also think that if we want to think a needs-based society, we urgently need to include their insights into our thinking. So I included like some definitions of social reproduction, that in capitalism it serves to reproduce the labor power in the capitalist society, but in socialism, of course, we wanted to reproduce a socialist society, so we have to think what that means, but it definitely means also reproducing people, labor power, and social institutions, culture, in other words. And in that, if we think about social reproduction, we also have to think about care work, which is a specific kind of work which involves emotional engagement and has a deep relational and ethical dimension to it. And there's different types of care work, some of it that is more direct, with direct human interaction, some of it that is considered to be more indirect. But in any case, it's important to think that care work cannot be treated completely as any form of work. And so it cannot be easily standardized, it cannot be easily measured. And in capitalism, the responsibility of care work is mostly taken by women, gender minorities, and racialized groups, and this is not, it's not random, there is a reason for that as well. We have to understand it. And care work has no final product, and it's never finished, as Heide Luthers says. And so it just kind of reinforces this idea that we can't treat it as other forms of work. So with that, in my work, I also really started from the perspective of looking at this separation between production and reproduction. And after working on this on this more abstract level, it kind of led me to still focus on two basic issues which will make Benki smile maybe. The issue of the scale of the division of labor to some extent, but also just other issues, and the issue of remuneration or accounting. So that's what I'll be focusing on today. So first, there's the big basic question of where should needs be defined and where should their fulfillment be organized? At what scale should we do that? There's kind of two extremes of the spectrum, we could say. There's on one side the community level, and on the other side a very high scale, like the national scale or the global scale. I'll start with arguments kind of for organizing it at a community level. So for some people, care work is more than something that we need. It can be the meaning of life itself. And so the relations, solidarity, and the social fabric are things that should be sought for themselves, and they can only be built if we organize care production, care provision within communities. And that needs to be done between people that know each other and that know each other on a personal basis. And so, for that reason, for a lot of people, care should not be reduced. It should just be done in conditions that are more meaningful and where people can access the resources that they need to produce it. And so such a vision leads to suggestions and proposals of common in care, which Benki alluded to, and at the end I put a quote from Federici. She says, reproductive commons become means of reappropriation of our decision-making power, of our capacity to reshape our lives. So this is way bigger than just saying that it's more efficient to do it, to organize care at the household or at the community level, but it involves issues of autonomy and collective decision-making and democracy. On the other side, arguments for organizing it at a higher scale rely on they say that the organization of care work would benefit from economies of scale, and we could reduce the time that is put in performing that kind of work, and also the resources, natural resources needed to do that. And such arguments often rely on the idea that a lot of care work is not fun. It actually sucks sometimes. And so it's not always something that we should romanticize and say that people should spend all of their life cleaning, cooking, and taking care of children. And so because of that, some people say, well, actually rationalizing part of it, trying to make it more efficient, is also very emancipatory in its way. And so a social organization of social provisioning could also reap economies of scale by using better infrastructure and better technologies that are more adapted, and we could also automate part of it to kind of alleviate the burden that it can represent for some people. So from there, my proposal is a multi-scale care system, and I think that if we want to be coherent with the approach and kind of the values of democratic planning or participatory planning, we have to apply the principle of subsidiarity, which I put a definition, but basically it means to organize the division of labor at the lowest possible scale, considering the perks of each pole that I mentioned before, and deciding together at the lowest possible scale as well, so involving people, only the people who are needed to organize that division of labor. And of course, the potential for economies of scale is different at in every sector and for every need being fulfilled. So often, the community reinforcing activities might be the ones that are the most labor-intensive, the ones that involve the most direct interactions, and the ones that are the hardest to actually rationalize and be made more efficient. On the other side, the other activities that can be made more pleasant, some activities at least, can be made more pleasant by organizing it at a higher scale with more technology. And so, yes, that depends on kind of the different components of need provision and different kinds of care work. So if we accept that, we need to say that different independent levels of planning will overlap. And I listed here some levels, but we can imagine having these different levels of planning taking on different aspects of care. I'll go into one specific example here to make it a little bit more concrete. I'm taking here the example of healthcare, which is not the best to look at housework, because a lot of it is not presently done within the household, but I think it still helps us to understand these different levels of action. And here, I would say I'll kind of present a three-tiered model, which is inspired in some way from a vision of healthcare that was prevalent in Quebec here in the 60s and 70s, but it also has ties to the Cuban healthcare system, for example. And so, first, we need some very specialized healthcare. But we might not need to cure a cancer every week, or not everyone has to do it all the time. And so, responding to these complex diseases, they also need very intensive, capital-intensive technologies, but they don't need to be kind of accessible all the time. So for that reason, it might be interesting to organize it at the national level. At the same time, we have other types of care. People also need to go to hospitals or kind of get some kind of medicalized care with the help of a physician or a doctor. And so because of that, we need these other types of services, which could be organized at the lower level, at the regional level. And then the most important level is that actually most of care work and healthcare that we need relates to routine and non-specialized care, which doesn't have to be organized at a higher scale than the community level. And so in Quebec, there was this kind of form of the popular clinic, which was organized really at the community level, which could be the neighborhood level, in which most labor-intensive and low-capital-intensive activities were taking place, which kind of related to about 80% of health needs. And in these clinics, you could have a collaboration of a lot of different specialists. And the most important thing is that they were very governed by the community and the workers together. And this kind of enabled clinics to focus on very context-specific needs. And for example, a clinic that would consider the built environment to be the biggest issue for health would lead people to focus on urban planning and kind of organize themselves on kind of addressing urban planning with the help also of community organizers within the clinic, actually. And then on the in another community, it could be the physical access to care that was the biggest issue, which led then people to focus on domiciliary care as the highest priority. And this could only be done if that kind of care was organized and defined at the community level. So what I'll present you kind of how the visual representation that I had of this, which I don't know if you can see, but I'll try to tell you, we can't read very well, but basically, this is kind of just how I saw, how I saw this. You can imagine here the different needs, having food, people care, health, cleaning, and more. And then you have things that should best be addressed at the community level, but some other issues which could be organized at a higher level. And here we can imagine this is kind of space, this is the local level, this is a higher division of labor, which implies the collaboration, political collaboration of a bigger polity size. And then we can imagine, for example, with health, having the first line care, second line care being kind of, devoted to different scales. And we can just kind of at least imagine it or kind of think through it in these terms. So, on that, I'll move on now to the second issue, which I believe still to be very key in thinking the divide between production and reproduction, because, of course, if one is paid and one is not, or one, it involves important issues. And maybe why is, okay, I'll go through this. And this is, of course, for the part of care work which remains within the private sphere. And it is a relevant question if any amount of consumption is tied to hours worked. And it's also relevant even if no consumption is tied to hours worked. It's still relevant if there's some kind of compulsion to work, which can be imagined if we say we'll fulfill basic needs for free, but if that can work, we still need people to work a certain amount of hours, and so because of that, there might still be a certain compulsion to work, and because of that, a certain culture of timekeeping would likely emerge one way or another. Some people argue that we should not pay housework, anyhow, and that argument is mostly based on the idea that it's only social labor that should be paid for. And social labor is labor that is useful to society as a whole. And André Goss says, well, the goal of care work is not social utility, it's actually the personal development of community members. And if we think that this is social utility, it's actually a totalitarian vision of it, of care, because we leave no space for the development of the singularity and unicity of the people we care for. And because of that, the private sphere must not be subordinated to social control and to criteria of public utility. And this is an argument that is taken by Winker and Neumann in creative construction, saying that paying housework would actually impose performance checks and kind of attempts to increase efficiency within the household or within the community. I didn't define what private means here, but it could be seen as the community if we organize the rest of care work, of work at the social level. On the other hand, some people say, yes, we should pay housework. And the feminist critique, of course, the kind of basic one is that even particular labor, which is kind of unique to each person, still is social because reproducing children is an essential activity for society as a whole. And people like Heide Lutters say, well, we don't have to pay all hours of work spent on care work. We can pay the average time that people need that is considered to be necessary for society. So in that sense, we'd pay socially necessary labor time, even if care work is not abstract work, because it is very particular, it is very concrete, and it is different from person to person, but we could still pay for the average time considered to be necessary for society. A big question is then, what is actually needed for society? Does society need you to keep your house and your collective housing completely clean all the time? Do children need to be cared for all the time? You know, like all of these questions then become like very present. So to conclude, the questions that I think remain here. First is, what about if different areas disagree on the scale at which we should address some needs or some specific needs fulfillment? And then if we have different scales organizing for the same needs. For example, if we look at food, we could have big dining halls, community kitchens, and solitary cooks wanting to cook at home. How do we deal with that? And how do we ensure that anyone can access their, and kind of have their basic needs fulfilled for free? This question is mostly there at that time, while kind of having these different layers happening at the same time. And especially how to ensure that the communities that want to provide needs at a lower scale, even if they are less efficient, if it takes more time, how could we ensure that they can fulfill their needs without asking them specifically to actually work more hours? And to me, it goes back to the question of saying if we pay housework within the household, there will be pressures to increase its efficiency. It kind of goes back to this this question a little bit. If we want to only ask everyone to work the same number of hours to fulfill their basic needs, but it's organized at different levels, it really brings this question. And I'm kind of bringing in Kokshot and Cottrell, which say communes should pay communal work in a different unit, different like labor voucher, a different currency than societal work, and there should be a kind of exchange rate between the two. That's kind of something to think further. Thank you.
Thank you.
Here. Thank you, everyone. What a great panel.
Where's the
That's true.